Hi everyone, welcome to another Doc Talk episode. I'm Dr. Logan.
I'm Dr. Betcher.
And today we're going to go over how to prepare the body for pregnancy. Last time, Coach Francis and I, we discussed what it's like as a new parent and the things that you need to consider as a new parent. But now we're going to talk about, you're expecting a pregnancy and what things you need to keep in mind in order to physically be able to withstand something that is very physically demanding.
Yes, it is a lot on your body. It's a lot for your body to go through for those months on end, and then of course ending at that finish line through labor. So you gotta take care of your body before, during, and after, all very critical, and generally speaking, it'll make the process just a little bit easier, or as easiest as it can be for you and your body, for you and baby.
Absolutely, couldn't have said any better. So first, let's start with talking about cardiovascular health. Obviously we know that is, even just general fitness, extremely important. You need to be able to have a good delivery system to deliver oxygen, carbon dioxide, and all the other nutrients throughout the body. But again, being pregnant, you now have to also make sure that you're delivering good nutrients to the baby as well. Having a good strong heart and lungs is going to help you with that.
Yes, certainly. And so there's some numbers that are thrown out there in terms of kind of how to know how that you're exercising at a safe level. I think general rule of thumb is if I were exercising, whether I decide to be biking, swimming, walking, even running, whatever it is that I'm doing, I generally would want to be able to still be able to hold a conversation. That way I'm not pushing it too far where I'm really out of breath and causing maybe a little bit extra stress to my body and maybe a little bit of extra stress to baby, but I'm still getting some good cardiovascular fitness in there, getting my heart rate going and getting some good blood pumped throughout the whole body, all those nutrients going to myself and baby. But I should be able to, maintain a conversation, be able to talk to someone while I'm doing that physical activity.
Again, you don't want to, the higher intensity the exercise is, the higher your core temperature is going to increase. So there's a certain level that could potentially be dangerous for the baby. So again, keep it at a light to moderate discussion conversation. Excellent. Good. Next, really important, cardiovascular health, but also resistance training is extremely important. Getting the musculoskeletal system strong, getting the tissue dense. There's going to be a lot of new stressors and pressures on the body now, so you want the vessel to be able to withstand all those new joint pains that are going to occur.
Yeah, and as mentioned before, your body starts releasing this hormone relaxin, so it's making your body, looser and able to grow so that it can provide the space for baby to grow. And so that relaxin is going to make everything all loosey-goosey, and we want to make sure that we're kind of combating some of that with some strength training, some stability work to make sure that your body is, again, kind of strong where it needs to be, as well as everything's just kind of getting a little bit looser.
Yeah, no loosey-goosey joints.
No loosey-goosey.
No, yeah. And then also just allowing the body to be to have an easier time carrying all this extra weight is going to be important. You're going to be having, as the baby grows in size, a lot more difficult getting up and down, transferring to and from the bed, in and out of the car, the bathroom, all right?
Yeah,
so,
tying your shoes. That's
dressing.
just you're going to be getting bigger, and it's just going to be a little bit more work, a little bit more effort, and especially once baby bump starts getting in the way too. But stairs, yes, getting in and out of the car, even as simple things, sitting to standing, going to the bathroom, that's all going to be more challenging. So we can do different things to still help strengthen the body to make those activities easier for you.
Absolutely. And then just in terms of next, the vessel that holds the baby, the pelvis, the pelvic floor, that in and of itself is extremely crucial to have strong. And why don't you go ahead and get a little bit more
that. So your pelvic floor, that's the base of your core cylinder. So very, very important in core strength, abdominal strength, and then it's just going to be getting a lot of extra load, a lot of extra pressure as things are growing down lower into that pelvis and torso. So pelvic floor health is very important as well. And it's something that I encourage, pre-pregnancy, during pregnancy, post-pregnancy, getting some pelvic floor work done by a professional. So sometimes that's internal work, sometimes it's external work, but really learning how you can control your pelvic floor. And some of those things would be helping out with issues like voiding and pains and things like that. Pelvic floor work and just learning how you can use it to be strong and be stable is really, really helpful during pregnancy. Something, like I said, throughout the entire process, something that should be happening even before pregnancy, learning about it throughout pregnancy, and then even post-pregnancy. Labor is very traumatic on your body, and so pelvic floor work following pregnancy is very crucial too, and it'll just kind of help you get back up to speed and recover even faster.
Absolutely, yeah. It can be embarrassing not having control of your bowel and your bladder with all this extra pressure.
Right, but it's normal. It's normal, so don't be embarrassed by it.
But again, there are steps that you can take
to make it better.
Exactly, exactly. So go to your healthcare provider, that someone that is well versed in pregnancy care, and they'll be able to show you some good exercises to help strengthen underneath, both before as well as after, tighten things up. And also there are some lingering pelvic floor pains that can occur after the fact. So dealing with those can also be beneficial.
Yep, exactly. Yep, you can get so much help by getting some pelvic floor work done throughout the whole pregnancy process. Yes, very, very crucial.
Absolutely. Next, sleep. So crucial. We don't get enough of it. One big thing that we always can use as just a good way to take some pressures off of specifically the back, the pelvis, the stomach, body pillows.
Yes, body pillows,
right?
Certainly.
So just having different ways that can take pressure off of the stomach. Obviously there are going to be some positions that aren't going to be beneficial for you even as the baby grows. So finding ways to stay comfortable so that you can get your sleep, get your rest and your recovery. Because obviously as the baby comes, that's going to be less and less of a...
Yes, and I mean, everyone needs more sleep. It's so crucial for the body to have that time to recover. So finding things like, pillows, specific pregnancy pillows that just help support and give some better cushion to different areas to get you a good night's sleep is very, very important, yes.
Absolutely, yeah. It's a time when you're not having gravity squishing the body. So ways to kind of take some pressures off the back, off the joints. That's a good time to really recover and help the body recharge. So speaking of recharge, most important thing of all, nutrition. Yes. Good quality foods is extremely important. Having nutrient-dense things, because you need to have the proper vitamins and minerals both for you and for yourself. But with that being said, the common phrase is eating for two. Let's dive into that a little bit.
Yeah.
Dr. Kelsey.
So eating for two, think of it more in terms of what Dr. Logan was just saying. So what you eat is what baby's getting, especially nutrient-wise. So making sure that, hey, I'm not just focusing, per se of my wants, needs, and things like that, but I'm also making sure that everything I eat is good for baby. I think a lot of times when we hear this phrase, eating for two, sometimes we think like, okay, that means I get to double up on all of my meals. And that's not actually the case anymore. Really, the eating for two and giving, your body the nutrients and calories it needs as well as baby, it ends up meaning that you can eat about 200 to 400 calories more per day. But that does not mean that you're eating 2 breakfasts, 2 lunches, and 2 dinners.
For 2 full-size adults.
Yes,
right?
Yes, exactly. I mean, you got yourself and baby, so very important that your nutrients are there. They're super good quality for yourself and for baby, but don't be confused in terms of I need to be eating double time, double load for every single meal. Generally speaking now, it's about 200 to 400 extra calories per day.
Very, very good point. Thank you. And stay hydrated.
Yes.
Very, very key. So, again, to refresh, preparing for a pregnancy, very important to have strong cardiovascular health, good to promote good circulation for the baby. needing good resistance training
Yes.
base, both before to get the body prepared for all the extra stresses and loads, and then also after the fact
Yep.
to kind of tighten things up and get all the joints stabilized. Next, pelvic floor health specifically for pregnancy. Super important for controlling bowel and bladder. Obviously things are stretched out as the baby is growing, putting more loads internally. So again, allowing things to tighten up, strengthen,
Yep.
super crucial. Sleep, that's our time when we heal. That is our healing time. So having good quality sleep is massive for you feeling right, having good energy, and allowing both for you and the baby to develop and be healthy throughout the pregnancy term.
Yes.
And then nutrition. Eat good foods for the baby.
Yes, good foods for you and baby, and then everyone will be happy.
Absolutely. So thank you so much for tuning in for another episode of Doc Talks. If you need any help preparing for pregnancy, please reach out to us. We're here at Elevate. We are here to provide you with the best care possible. So thank you so much.
Yes, we'll see you soon.
Thank you. Bye now.